Good afternoon. My name is Dr. Ed Vallely, and I'm here with Jerry Elasic, president of Artistic Dental Studios, and we're here to talk about doing the Refresh Smile final restoration in only 2 appointments. Now, I kind of want to spend a couple of minutes talking about why you might want to do that. So here we are, we've got our patient, we're 4 or 5 months down the road. Everything's great, they love their temporary, and it's time to make this final restoration. The glow of all the hugs has disappeared. The money that you got from collecting it all up front at the time of service has long since been spent, and you're about to be hit with a lab bill of $19.95 if you use Jerry's lab, maybe up to $3,000 other places. And you're going to get to put nothing on the books for between 2 to 5 appointments. Now, you're not going to like that very well, and we want this to be a procedure that we can do for more patients. So by showing you how to do this in 2 appointments, you can be more efficient, you can be more accurate, and you can deliver this in 4 to 5 weeks for the patient this way in 2 appointments, or you can do it in 5 appointments in probably 10 to 12 weeks. So it's a win-win to do it this way, but you gotta have 2 things. First thing is you have to have a good articulator and a face bow, one that you really like to use, one that's accurate and simple. And the second thing is you have to have the will to do a little bit of lab work. If you don't want to do that, Jerry has said that he can send a lab man out to your office, but there's a fee for that. So preferably if it's dental school stuff, I'm sure there's guys out there that haven't poured a model since dental school, but have your assistant do it or something like that. It isn't really that hard, and it works much to your favor to do it that way. So Jerry, do you have any comments that you'd like to make on doing this in 2 appointments, things to look out for, things to make sure you get done so that it doesn't mess you up? And
yeah, I think the first time we went through this, kind of like a belt and suspenders type of person. I want to make sure everything is going to be perfect. And the 5-step method, when you do it that way, and that's basically industry protocol, is the way it's done. Basically you're starting all over, reestablishing the bite, reestablishing the aesthetics, reestablishing, making sure your model's verified, and working through it that way. If you end up with a case or restoration where the aesthetics are where you want them and the patient likes what they have, this just simplifies the process so much. It takes errors out of what we could possibly do in the laboratory, or way models are poured and things like that are articulated, to a system that I think I was a little doubtful when Dr. Vallely first brought it up to me. But after I saw it work, I'm like, I think this will work. I really do. So I think that's where I'm with it, the whole case.
good. We'll be pointing out things where I think you're actually going to be more accurate and eliminate a lot of possibility of error as we go along. So let's go meet the patient. Okay, we're here with our patient now, Kathy, and you had your surgery back in January? Okay, and she's been wearing her temporary ever since. She likes it a lot. You've had really no trouble. Tell us a little bit about what it was like right after the surgery, adapting to it.
It was fine, actually. It was no different because I had a partial one. So it was just nicer. I didn't have to take it out at night. And everything was fine. Healed real well. No pain.
I know you took good care of it. You were very careful, taking good care. So it's paid off. I think we'll notice how nice your tissue looks. You just had it checked by Dr. Frank last week? Tuesday, okay. The implants all were sound. Everything's ready to go.
Yep.
He's pronounced you ready.
Ready for this phase.
Okay, very good. couple things while she's sitting up I'd like you to notice is when she's at rest right now, you're seeing some incisal show that we didn't really have that. And when she came in today, we had discussed that we wanted the teeth to look a little bit longer. So what I did is I added composite to all the upper anteriors, and we went through and tested the phonetics and the aesthetics, and she likes it. Like I say, now you can see that she has, she's showing more tooth. She's was happy before, she's even happier now. So this is the incisal edge position that we're going to actually use. We'll show you how we do that. Okay, let's go to work. All right. Now, one of the premises of this procedure would be that there's nothing wrong with the temporary. You can't have any cracks, any breaks or anything like that in it. It has to be intact because we're actually going to use this as our impression. We're going to just take a wash impression and go from there. Put the analogs in, and away we go. So it has to be in good shape. I've had them come in where they're cracked and broken and you can't do this. This can be one of the more frustrating things is picking the, whatever it is you sealed these copings with out of there. We've found a little tip that I'd like to pass on is if you use retraction cord and put that in instead of cotton pellets, and then use some kind of vinyl polysiloxane. Before we do this, we better take our bite. See, I almost made the mistake that I wanted to warn everybody about is not taking the bite first.
Mm-hmm.
Okay, now what we're doing is getting our bite registration, and one of the beautiful things about this technique is you have the prosthesis, go ahead and bite, is screwed into the implants. It's perfectly stable, as opposed to playing around with a bite rim that's tissue supported and moving, and this has got to be way more accurate than the bite rim method. So it takes about, I'm using Regisil right now, bite registration material, fast set. I tried putting this in the holes as a sealer, but it turned out it's so rigid and so brittle that it would break off and just break. So I found that just a light body vinyl polysiloxane to be a better thing to seal the access holes with. All right, we're set. Okay, go ahead and open. Thank you. All right, there's our bite. Now we're going to do a face bow, and this is the Cois face bow system that I'm using. It's very simple. It consists of just two things. One is like a fox plane and the wafer. And if you actually have somebody at the lab that has a Canadian articulator, you can send just the wafer to them and they can mount exactly the way you can on yours without having to send the face bow, send the articulator. You can go back and forth between articulators. They're all calibrated. So it's a really nice system. So the little wafer, I don't want to spend too much time on the Cois, but what you want to do is you want to put her central incisors right up against this, and I'll let you go to the website to find out. He's registered this position to the hinge axis and found that it's 99% accurate in most of the population. The other component is what's the vertical component that just goes on here. And so we're going to put it in her mouth. we're going to line up in the middle of her face, her facial midline, not her dental midline, her facial midline, and then we're going to just have these components to be vertical, and then we'll put that on the articulator, and it gives us a very accurate representation.
You're gonna tell me when I have to open my mouth or what they are.
Okay. We've gone ahead and softened these little, they're just little compound wafers, and you just put it in, and you get your stop right up against the central incisors. Now, what I do is I get directly behind Kathy and get this so we are absolutely in the middle of her face. And then we have the other components in the vertical plane. Nothing in the ears. I'm just letting that compound set up a little bit. Double checking. And that's it. That's the face bow, all done. Okay, we've got our bite and our face bow registration. Now we can remove the prosthesis and go about taking our wash impression.
Bye, Sam. Bye.
Now, if you've never done one of these cases, you're going to be flabbergasted at the size of the little screws that holds this prosthesis in. They're very, very tiny, and you gotta be kind of careful, or you can lose one of them. You know what I mean?
I think one thing I would say also, if you notice, if you press down on the top of the driver as you turn it out, and when the last thread comes out, you actually have a tactile feel where it'll click,
Yep.
make an audible sound, and also a tactile feel to it that you know the screw is now out of the restoration.
You want to inspect and make sure that the tissue surface of the prosthesis is good, no cracks, nothing loose, especially that the copings aren't loose. And we're looking at Kathy's tissue, and it really looks beautiful. It's epithelialized beautifully. Good tissue color. Just needs to be rinsed off.
I just wanted to get a picture of that.
Okay. Rinsed off. Now, guys, all we're trying to do is get a wash impression of the tissue surface of this to compensate for the healing that's gone on over the past 3 or 4 months. This is your impression. This is exactly the same thing as if you went and took impression copings, screwed them on, put them together however sophisticatedly you want to do it. There's all kinds of techniques that are like building a thing in and of itself, just taking that impression. This is so simple, it's there. And nothing could be more accurate because the implants have actually healed into this. Okay, so nothing could be more passive than this appliance sitting on those implants. I mean, it's just, they healed into it. So all we have to do is get a wash impression so that when we make our final, that tissue adaptation is going to be just perfect all the way around, and she won't be getting food and debris, you know, underneath the prosthesis. So I just use light body and heavy body, do a little tissue molding, and that's really all there is to it. It's a very simple procedure. Go ahead and cut, Sean.
Yeah, at this point, what we're doing is placing on a little tray adhesive onto the prostheses itself, placing as little as you can to hold the impression material to the prostheses during the transfer and pouring up, but not so much that it would take you a long time to clean back up and then redeliver the prostheses. The point to always look for is looking inside the multi-unit abutments here to make sure that there is nothing inside them, any food debris or particles that might get picked up. And also at this particular point, when you're applying the material, to make sure that there's no impression material seeps inside the impression coping, because that'll lift up. So you try to keep this away from there and let the material move towards the center. Now we're using just a hand instrument to flow the impression material around to make sure everything's covered, but yet it's a lot easier to use that than try to do it with your impression gun. You just have more control. You look for the implants and then seat the impression coping on. Try to do as evenly as possible and just seat. And then as the impression material is still setting, you place the screws back in. It's nice at this point to have multiple drivers with the screws already loaded. So this way you're not fumbling around trying to seat the prostheses and then put another retaining screw on the drivers. So you need at least 2 to 3 drivers at this point, and this works much more efficiently.
Okay, now what I'm going to do before we run out of setting time here is do some muscle molding. I've got 2 screws in there. It's not going anywhere. Let me have a little at night. Was there a screw in there?
No.
Okay.
One thing with this, you always want to remember which holes you put the screws in. I've seen where we've doubled up screws and you think it won't happen, it will. So. And then when you're trying to take it out, if you've doubled up a screw, we've actually seen them where they've screwed the top of one screw into another one. And then when you're taking them out, you think you can't get one out. And then you think you've taken one out of the other one, but there's still another one in there. So there's all these little
Did you set the timer?
situations that cause the time just to run out until you can figure out what's going on.
You can probably cut. We got a couple minutes. Okay, we're ready to remove our impression. I just want to say one thing. For the sake of the video, I'm not wearing a mask so that you can hear me better. Normally I would have my mask on, always. So I didn't mean to imply any break in asepsis here. there's that tactile click that Jerry was talking about.
Keeping well?
Yes.
Comes the case, yes, as a traveler, there's some instructions, usage of the record, and there's a case to the tray. Okay? Each one of these is all 40. So imagine using 40.
Number 10 is right.
This one?
I actually created one that just do Matthews, then you can see a little difference as time goes on. Plus, it's moving around, it's too much in there. Add the material along with this. So right through again. Okay? This is what we want.
One stuck in my finger. Okay. All right, so let's see what we've got. Got a nice wash impression. No impression material inside the copings. Decent border mold. And that's it. What could be more accurate?
And during the time that it was setting, the prosthesis was screwed in place, so there was absolutely no movement, hand movement, that could have taken place while the impression material was setting. So it's probably the most accurate way to take an impression.
The next step will be just to box this up. Jerry brought up the reason for doing the boxing is if you would put your copings or your analogs in here and then set it on a patty, you could be hitting on one of those analogs and distorting things a little bit. So it's best to do the old dental school, box it up, pour it up, and that way you know you haven't done anything to possibly distort it. So meet you guys in the lab.
We have everything boxed out. As you see, I sealed around the inside border so the wax doesn't go around. On the bottom you can see our wax bead that we placed in utility wax. And then in the center I filled in a little bit of the rugae area that's not going to be part of the prostheses that didn't get impressed since we just used the prostheses. That's one thing you might have to get used to looking at. It looks more like a maxillary could look more like a lower impression than it will a maxillary impression, just because of the fact that we don't have that. But we don't need it for anything, so there's no reason for having that. Notice the analogs are all covered, and so we're good to go. All right.
Jerry, I just wanted to point out one of the nice things of the Panadent articulator is this adjustable base that they have here. You see how stable this is. You don't have some contraption of a face bow that you're putting on there that you're tightening screws and it's all wobbly. This thing sits on there. It's rock solid, and it makes mounting that maxillary cast just a breeze. So that's one of the great things I like about it. We'll show you what we can do with this table. It's adjustable up and down.
Keep your bowl handy, and everything sets in. Make sure you're down inside your bite, and we're good to go. And that's it. And there you have it. So here, now what I do basically at this point, you just use your fingers. You move it around. I'm starting to smooth it. And what this does at this point is it just causes you less sanding and plaster work that way. You could clean it up. It's easy to wipe off your fingers. You smooth it out so when you go to sand it, you don't have much on there, and you wipe it off. Once you get your initial set, all I'm doing right now, everything's it. This is just for cosmetic purposes so that when the case is presented, if you happen to show it to the patient, everything looks neat and clean. If you wet your fingers, you take it off a little bit. So at this point, I'll pretty much stop here, let the stone get a better set so I don't ruin anything, and we'll go from there.
Okay, what we want to do now, because we have to give the teeth back to the patient, we need to be able to show the lab where the incisal edge of the maxillary teeth are going to be. So we're going to make an index. And remember now, we added composite to the edges of this because we wanted to lengthen the teeth. So I want to record this new position, and we've carried the whole thing through to this point on the model. So what I've been using, this is just Regisil, and I get it so it's going to stay on the lower model. And this comes in really handy when you have to caulk the bathtub. You're pretty good at it by doing this. And then you just kind of pat it in so it fits really nice. Okay, this only takes about a minute to set. And then what I'm going to do is I'm going to mark the midline myself so that nobody can have a mistake, accident, or anything. No question about where that midline is. The index is set, and I've cut a little V shape in there on the midline so nobody can mismark it. And it's ready to go to the lab. Give it back to the patient. Okay, so now what we've got, I've taken the prosthesis off the model. Here's our master model. Everything's mounted. We have our incisal edge index, and it's basically up to the lab to fill in the blanks. They know where everything is. We've got our vertical, we've got our incisal edge, we've got our master model, and it's all done. This took us 2.5 hours. We could have been a little faster if we weren't filming. Figure the first time you do it, I would say it'd take you just about this long. But now the next step is to give it to the lab. They'll do everything and then send it back to you, because there's no reason to try it in because everything is done here. You have absolutely everything that they need to know. No point in verifying anything. If they just follow that index, it's all going to be there. So the next thing you'll see would be what Jerry does at the lab to get the bar ready, and then that'll be the next step. And then when it comes back, they'll show you how they process the acrylic and set all that up, and then we'll finish it up and deliver it. Kathy gets her teeth back the same day, and we screw it in. Getting the first screw in was always the tough one. tight. And then the secret weapon of the packing cord.
The reason we went to cord versus using cotton pellets is that we're going to be plugging the hole with just like a polyvinyl
Yep.
material, and it captures the cord, and so when you remove the polyvinyl plug, the cord comes with it. Cotton sometimes will either tear and stay down there, so there's always some cotton maybe stuck down the hole, and it's very difficult to see it, and you don't know if it's there or not, so it can become real frustrating to try to remove a screw. But with the cord, once you capture one piece of it, it just pulls and everything comes out.
You want longer?
Because then for sure it won't come out, and you're always going to leave one in there, and then if you take your driver and try to remove it, all you're going to do is burnish it into place.
This material works very, very well. Easy to remove. Only thing I wish was that it would set a little bit quicker. But so far it's the best material I've found for staying in and yet easy to remove. So, okay, you go ahead and bite. Feel like your old self again?
Yes.
Okay. We're done.
Yay!